Good evening.
Good evening.
It is an honor and a pleasure to be here tonight with all of you at the Leadership Alliance National Symposium to celebrate 25 years of academic excellence. I stand before you this evening as a woman with an incredible opportunity. And I hope that each of you will utilize every resource at your disposal so that you too one day can have this opportunity. The opportunity to wake up every day and go to work to a job that you love. This week in my clinic, I saw one of my patients in follow-up. He's an elderly gentleman, very nice gentleman with refractory diffuse large B-cell lymphoma. And my first encounter with him was several months ago when he was coming to us for consideration for treatment for his disease on one of our clinical trials. He was symptomatic at that time and was having some pain and discomfort, so we were moving quickly to try to get him enrolled in our protocol. And as part of the study, there was an optional biopsy. And the purpose of that biopsy was to acquire tissue that we would use later for correlative studies in the lab, trying to identify biomarkers that would be associated with treatment response. So we discussed the details and the logistics of the biopsy and the indications and the rationale, although it was optional. And he said to me, Dr. Pinnix, if me doing this biopsy will change the lives of those behind me, then I'll do it. And this is just one story and one patient, a couple minutes of the day that I have almost every day, every week. I have an incredible privilege, and I have a profound appreciation for the privilege that I have to take care of cancer patients facing the most difficult times in their lives. I have the opportunity to do research. I have the opportunity to design clinical trials, to be an educator to help train the next generation of radiation oncologists. And the dream that I have realized wouldn't have been possible without the research experiences and the mentorship that I received during my undergraduate career. I was a Meyerhoff Scholar at the University of Maryland, Baltimore County. I'm not going to tell you what, I'm an M blank. I'm not even going to tell you what it was. And I was also a participant in the Leadership Alliance Summer Research Undergraduate Program. And those experiences really opened up my eyes to fields that I was really unaware of. As a child, I had career aspirations in medicine, and there are lots of childhood photos of me that reflect that. I always picture of me with a stethoscope. I wanted to be a physician. I wanted to be a doctor. I knew that. But I was unaware of the merits and the rewards of careers, research-based careers, until going to UMBC. So in the Meyerhoff program, they really encouraged us to explore research opportunities, and to that end, I entered the Leadership Alliance Summer Program after my freshman year in the summer. I went to Brown University also, and I worked with Dr. Mary Carskad, and she's a professor in psychiatry and human behavior. And then after that summer, I returned to UMBC really excited about research, and I joined the lab of Dr. Michael Summers, who's a Howard Hughes investigator on the UMBC's campus. And then after that, my summer after my junior year, I went to NYU with Dr. Joel Oppenheim. I know I saw him earlier, I know he's here. And I worked under the instruction of Suman Lau, who was an immunologist who did research on the pathogenesis of tuberculosis infection. And it was through these research experiences and through the mentorship of dynamic and committed mentors and academicians such as Dr. Oppenheim and Dr. Summers and Dr. Rabowski on UMBC's campus, that I found myself on a very unexpected path, which led me to the combined degree program, MD-PhD program at the University of Pennsylvania. And now, 20 years later, actually a little more than 20 years later, I work at the #1 cancer institution in the country. I am the first African-American female in my department. I know we talked about not wanting to hear that we're the first at something, but I'm the first on the tenure track in my department, and I was recently promoted to associate professor, and that'll be effective in the fall. Thank you. I'm a mentor, I'm an educator, I'm a physician, I'm a clinical scientist, I'm also a mom and a wife. Yes. So, in thinking back to my patient who, in the midst of fighting a battle against a fierce opponent, refractory lymphoma, decided selflessly that he was going to give back, potentially impacting the lives of patients that he'll probably never meet. In that same vein, each of you in this room has that incredible potential and opportunity as well. Through the pursuit of your passion, you can find a way to make a lasting impact. I'm really impressed with all the things that all of you guys have accomplished, and I strongly encourage you to stay committed and hungry. Thank you.